video was smuggled out to us anonymously from a big city Canadian hospital because we weren't allowed in. On the way to intensive care, you can see the visitor seats blocked off. The halls are empty. But one doctor told us they all know a tidal wave is coming.
Colapsando las urgencias.
This is the nightmare scenario. This New York Times video shows hallways in Spain jammed with sick patients, nurses making their own protective gear. And now, photos on Facebook suggest it's starting here. Patty Tamlin got SARS on the job in 2003. She's still an ER nurse, but now her husband is battling cancer. She says she would never quit, but
if I do not have the equipment that I need to walk into a room, I have myself, I have my husband, I have my children and grandchildren that I need to protect ultimately.
Dozens of other worried nurses told us they fear losing their jobs if identified. But one shared this email from her hospital advising, "We have roughly a 1-week supply of masks." Another nurse from Alberta told us that after they refused to do COVID tests without the N95 mask that used to be called for, "This didn't go over well. I was made to feel belittled and my concerns dismissed." And an Ontario nurse posted this: "Less than a month ago, I could have faced disciplinary action for wearing the same mask between patients, but now it's what we're being told to do. I'm not safe. My patients aren't safe." Linda Silas is head of the Canadian Nurses Union. We connected over Zoom. So Linda, some healthcare professionals that we've talked to are suggesting that we're in a global crisis, that nurses just need to share the pain, share the risk.
We're not going to share the pain or the risk with our lives. We work in that field knowing we need to be there, especially in these times of pandemic and other emergencies. But to do that properly, we need to be protected.
So as you can see, nurses are begging for more supplies and tell us that if we don't better protect them, we could end up like other places in the world where they are now begging for more nurses. Wendy Mesley, CBC News, Toronto.